Good afternoon. It's 2:01 p.m. So let's get started with our webinar today. The purpose of today's webinar is to raise awareness about mental health and provide available resources to those veterans suffering in silence. We know that mental health is an extremely important part of our overall health. This webinar today will only address the VA resources that are available. We will not address best treatment options, symptoms, medications for mental health. Again, as I stated earlier, this presentation is only to address the various mental health resources available to veterans at all VA medical facilities. Next slide. My name is Christine Golden, and I will be the presenter for today's webinar. Next, please. Who we are and what we do. VetsFirst is a program of United Spinal Association. We have represented veterans and their family members for over 75 years with VA monetary and healthcare benefits claims. Next, please. Our VA claims representation is free, as well as free answers to most VA benefits questions that can be found in our extensive collection of knowledge books where you can find at our VetsFirst webpage. And when you visit our knowledge book collection, you can find helpful information about VA compensation and pension benefits, educational benefits, healthcare, life insurance, burial allowance, etc. Next, please. May is Mental Health Awareness Month. It's a time to raise awareness for those veterans living with mental or behavioral health issues and to help reduce the stigma so many experience. The VA medical centers and the clinics, they play an important role in providing behavioral health care and helping veterans find resources available in their communities. Next, please. VA has a variety of treatment options, resources, apps available to veterans in crisis. Next. As you can see, VA has a wide range of services available to veterans facing challenges such as social and physical issues. These services, they are provided in all healthcare settings throughout each VA medical center. For example, a veteran who is living in a community living center, formerly called a VA nursing home, or if a veteran is just receiving care on an outpatient basis, they still all have the same access to mental health resources. So it doesn't matter what type setting the veteran find themselves in. Again, they all have entitlement to these healthcare services, either on an inpatient basis or an outpatient basis. Next. PTSD, depression, substance abuse, anxiety, these are just some of the mental health conditions that each VA medical center treats. So veterans, they do not have to be in receipt of a monetary VA benefit to receive some of these services. Next. Help is available to those veterans facing challenges that affect their life, health, and relationships. You're not alone. The first step is to talk to someone such as a loved one or a friend, but the main goal should be seeking professional help from an experienced VA mental health specialist. Next, please. First, I want to define VA's definition of a stressor. A stressor is a traumatic event. For example, a veteran with PTSD stressors, they may have been exposed to trauma either in combat, or they may have witnessed individual being killed or seeing dead bodies on the ground, or just actually receiving a threat to their own life, as well as an actual or threatening sexual violence. That is what a traumatic event is. It can be the traumatic exposure can either be a direct exposure, or witnessing in person the traumatic event. A brief description of some of the resources that's available to address stressors are coaching in care, which is a program for family members and friends of veterans to encourage them to get help. Make the Connection is another program, and this program is for veterans leaving active military service and transitioning back into the civilian life. Most of us veterans leaving military service after an extended period of time, we know that transitioning back into the civilian sector can be very difficult. And next we have the National Call Center, which is manned 24/7, and it's for those veterans who are currently homeless or at a risk of becoming homeless. Next slide. We know that veterans are at a 50% higher risk of committing suicide than their peers who have never served. So here are some options that are available to address these stressors, such as the Veterans Crisis Hotline. This one also is manned 24/7, and it's manned by peer counselors who are veterans themselves and who understand the challenges that veterans and their loved ones face. We have the Vet Call Center. They offer confidential help for veterans and their families at no cost in a non-military, in a non-medical setting. And the vets, they can either call or they can talk. When a veteran call into the Vets Call Center, they can call and talk to another veteran who, about their combat experience. Okay, that happened to them in their military when they was on active military service. And we have the Mobile Vet Center, which is often called upon by the VA to support its mission in providing emergency services in response to, say, for instance, national disasters or national emergencies. And these mobile apps, they help the VA to reach those who may not otherwise seek VA services for counseling and mental health support in an actual brick and mortar type setting. So I strongly encourage any veteran who's dealing with relationship issues or a loss of a job or emotional issues to just call for help because we know that everyone faces difficult times in life, and people, they cope with stressful situations in different ways. So again, these services, they're available even if the veteran is not enrolled in VA healthcare and if they're not receiving a VA disability compensation payment. Next, please. Here we have a few more resources that are available to veterans and their family members that provide support, recovery, and reintegration back into the community. As you can see, we have the National Resource Directory, the Veterans Coffee Social, the Women's Veterans Call Center, and Coaching into Care. That's just, again, some of the resources that's available to assist veterans who are in crisis. Next. These resources that are available here, the National Alliance on Mental Illness, the JED Foundation, and the Mental Health America, these resources, these are resources that are available outside of the VA, and it's for veterans as well as for civilians. I've noticed this past month, May, because May is Mental Health Awareness Month, that I've seen a few billboards and PSAs from the National Alliance of Mental Illness Foundation. Next, please. VA, they have several mental health services available to veterans either online, via computer or smartphone or any mobile device. And one is the Veterans Training, which is a free VA course that's available 24/7, and it's 100% confidential. So although these courses, they may help a veteran in crisis, they're not intended to replace treatment by a healthcare professional. And these courses, they do not provide a certificate of a completion, nor do they fulfill court requirements. Next slide, we're going to talk about smart apps. Here we have the smart apps that are available to veterans to assist them with such things as relaxation, stress, substance abuse, TBI, MST, which stands for military sexual trauma, problem solving, etc. Again, these apps, as well as some of the other resources that I spoke about earlier, they should never, never, never be substituted for mental health treatment. They are just simply a tool that can be used along with professional mental health. Next, please. So as I indicated on the earlier slide, VA, they provide a range of mental health services, both in-house and on an outpatient basis, such as short-term inpatient care, outpatient care, virtual care, supported work settings, and inpatient rehab programs. We have the vet centers, again, which they offer confidential support to veteran service members and families at no cost in a non-VA setting. And the services that are provided at vet centers are such things such as to help with depression, PTSD, and military sexual trauma. And the Veterans Crisis Center, the emergency mental health and crisis centers, again, those are also monitored 24/7. Again, please. Next. In 2006, Congress, they established the Office of Rural Health Resource Centers at 5 VA medical centers, which is located in Iowa, Salt Lake City, Utah, White River Junction, Vermont, Gainesville, Florida, and Portland, Oregon. And these facilities, each one of them have a specific rural focus. And the focus is mostly on mental health issues, as you can see from the three that are highlighted in red. Okay, they mostly focus on mental health issues. And VA's mission for establishing the Rural Health Resource Center was to improve the challenges that veterans face living in rural areas, to identify disparities in availability for healthcare to veterans living in these rural areas, and to enhance the delivery of healthcare to those veterans living in rural areas. Next slide, please. So if you're a veteran in crisis, or you know of a veteran in crisis, there's help available 24/7. You just need to make the call to find the right resources that's available for your needs. Again, you do not have to be enrolled in VA healthcare to get some of these services, such as military sexual trauma. That service is available to any veteran who experienced this type of sexual trauma during their active military service. And we spoke earlier about the Beyond Military Sexual Trauma mobile app. And I just wanted to add that VA, they also have military sexual trauma coordinators at each VA medical center that handles this type of trauma. And like other types of trauma, military sexual trauma, it can negatively affect a person's mental and physical health even years later. Next slide. So some important notes before I close. Just because a veteran has a mental health condition or they're seeking mental health care, it doesn't mean that their job will be at risk. We know that most employers, they recognize that healthy employees who get help when they need it, that they're more productive and effective in their jobs than those who aren't performing at their best because they're not feeling well. VA, they provide same-day services to address mental health needs. So if the VA can't see a veteran, what they will do is they can either meet with that veteran via a mobile app, or they can meet with them virtually on their computer. And again, I just want to stress that help is available 24/7. It's just a phone call away. And for those veterans owning guns, I just have to say, please, please, please make sure that you lock any unsecured guns, because especially during a crisis, because statistics shows that a suicide attempt by a gun is fatal 85% of the time. In 2008, VA, they began giving out gun locks. And what they were doing is they were modeling this national gun safety program called Project Child Safe. So every time that I visit the VA or a VA clinic, I make sure that I grab a handful of gun locks for family or friends, or just to keep in the office for any veteran that may be coming to my office. And, we get to talking. I talk about PTSD, and then I make sure that I mention to them if they have guns, and then I offer them gun locks. Because we all should be thinking that if these guns are locked up, that a veteran in crisis may not reach for them in the spur of the moment. And as I stated in my opening, whether we all have to realize that mental health, it plays a huge role in our overall well-being. And because when you're mentally healthy, you're able to enjoy your life and the people in it, and you feel good about yourself and your relationships. And mostly you're able to deal with your stress. Next slide, please. And this is just a few of the resources that I use to do my presentation today. Next slide. So this concludes my presentation. So if anyone has any questions, you can just put them in the chat box. If we do not have time to address your question today, just make sure that you leave us your email address and your phone number, and we will respond to your questions in a timely manner. Again, this webinar was just to give you an update, not an update, but just to make you aware of all the resources that are available to veterans who are enrolled in VA healthcare, and if they need help for any mental health conditions. Again, this webinar isn't to address symptoms or treatment options or medication. And last slide, please.
Oh, I had stopped it. Sorry, I thought that was the last slide.
That's okay. My last slide was just going to promote that United Spinal Association, we're hosting another webinar this Thursday at 3 p.m. Eastern Standard Time. And the webinar is going to be on mental health. It's a candid conversation from both sides of the chair. So our United Spinal Association team, they will be hosting that free mental health webinar again this Thursday, May the 12th at 3 p.m. And the presenters, they will discuss mental health issues from, the perspective of being in a wheelchair. So again, if anybody has any questions, please let me know. And like I said, if we don't get to it today, we will make sure you give us your email address or your phone number, and we can get back to you with the answers to your question. And that's all I have. Angel, do you see any questions in the chat box?
No, I do not.
I don't see any either. So no questions, then I guess this concludes our webinar. Everyone have a nice day. Thank you for participating.